Hello, my name is Holly Proctor. I'm the publisher of Inside Singletree Magazine. I'm here with Andy Odie, a Singletree resident, a broker at Liv Sotheby's International Realty, our exclusive video sponsor, and co-hostess of this next episode of The Story Behind the Story. Today, we're here with Carrie Benway, also a Singletree resident, who is Executive Director of the Hope Center, and Dr. Teresa Haynes, the Clinical Director for the Hope Center. So we're here today to learn more. We know how important an issue of mental health is here in the Valley, and the Hope Center has a really, really important role that we're going to learn more about today.
Yay. Well, thank you, Holly. And you're right. This is a very important subject and a very important story behind the story. So we are going to find out more about this newer 501c3 nonprofit. And Carrie, what a great nonprofit this is. So share with everyone just how this got started. I know you've been with this nonprofit since the beginning, and it really just changed a little bit recently. So give us the story behind the story.
Thank you, Andy. Thank you, Holly. Teresa and I really appreciate being able to talk about the Hope Center. And I first became acquainted with the Hope Center in 2015. I was president of the Board of Education, and I heard about their remarkable mental health agency and the service they were providing in schools. And so we started the conversation then. They asked me to join their board. And then eventually in October of 2018, we were able to open an office here in Eagle to serve the whole Eagle River Valley. And we serve the Valley with two programs. We have a mobile crisis co-response program, and then we have a school-based program. When we opened our doors in October of 2018, we were a part of the Aspen Hope Center. But recently, as of January 1st, 2021, we are our own separate 501c3. We are continuing to partner with the Aspen Hope Center, but we are operating as our own here to serve our community directly. We will have a local board, and we have our teams out in the community serving people as we speak.
Yeah, I love it. It really truly is a collaboration of several different entities that have been involved. I know recently we spoke with the Speak Up, Reach Out nonprofit, and how you both help each other out in getting the right message, education, and obviously with the hotline and everything else of the services that you provide with the county here.
Maybe you could provide a little bit of clarification on exactly how that relationship works.
Sure. So when we talk about the Hope Center, it's really important to say that our work is only possible through the collaborative efforts with our partners. For our mobile crisis co-response team, we partner with law enforcement and community paramedics, as well as Colorado Mountain Medical, all of the other agencies in Vail Health. I mean, we are just very fortunate with the strength of our partnerships. And then with the school-based program, we would not be able to have a program without our partnership with Eagle County Schools.
Absolutely.
And then, as Teresa and I both work closely with Speak Up, Reach Out, do you want to talk about our relationship with Speak Up, Reach Out a bit?
Yeah, I think it's a very valuable relationship. Speak Up, Reach Out does a lot of work around education, prevention, and then we can step in with the direct delivery of services. So direct taking of the phone call, going out into the community to help support. So we're also partnering with Speak Up, Reach Out and at their initiative in 2021 to do kind of a psychological autopsy. So there are several of us that have been certified with this program. And again, working with Speak Up, Reach Out, as well as law enforcement to really examine the suicides in our county, to look for identifying factors that are specific to our community, and then lead to increased prevention and outreach kind of efforts. So that partnership is just extremely valuable.
Right, which then ultimately gives the awareness for everyone of that educational aspect early on within the school system.
Exactly. And it's great because we're not competitive with each other. Yeah. We all support each other. And so without Speak Up, Reach Out, the training and the schools that Speak Up, Reach Out is able to provide, then the kids are learning how to ask for support, what signs to look for if another student is in trouble, and then our Hope Center therapist at the school is able to provide that direct service and counseling.
Right, it gives them a comfort level and knowing that it's okay to be able to speak up and then also know to look for the signs and having that support.
Are you working with all the schools in Eagle County?
We are in 13 schools as of today, and we hope to continue to expand.
That's great.
That's
Fabulous.
Yes,
Yeah.
but we are grateful because, believe it or not, in October of 2018, we started with 2 schools. So
That's
look
what I
how
was
quickly
wondering,
we've grown. In 2.5 years, we're in 13 schools. And the reason we're able to do this is because of the tremendous support we receive from our partners. We do not charge fees for either program, either for the mobile crisis co-response or the school-based program. All services are free of charge.
Yeah, well, and of course, the community support as well. They realize the importance of this and having the hotline, if you want to talk a little bit about the hotline.
So we have a hotline that's staffed 24/7 with licensed clinicians. So if there is ever a need to pick up the phone and talk to someone right away, that's the service that we provide. I think one of the real differences, to kind of reiterate, is that there is a live person on the other end who is a trained clinician 24/7. So while we don't, as far as the hotline and the crisis clinicians, we don't provide ongoing services, that we have incredible community partners that do that in our community. But we are someone while you're waiting to get in, waiting for that appointment, or you just need to talk to someone right now, no matter what time of day it is, that's what we do.
And what's unique about our program too is that we go to the community member. So if somebody calls us and the clinician who answers the phone hears the need to be seen right away, we go to that person, whether it's in Gypsum or in Vail. We are able to respond on scene and provide and conduct that behavioral health evaluation. And then we come up with a safety plan to keep this community member safe, and that might involve reaching out to Colorado Mountain Medical or another agency to get them in with a therapist. But as Teresa said, the difference with the Hope Center is whether it's 2 o'clock in the morning or 2 p.m. in the afternoon, you're going to have a therapist who's available on the phone to speak with you.
Yeah, it's just so important, and what a beautiful, beautiful service for the community. So thank you so much.
So tell us about the school-based program. That's the other component of the services you offer, correct?
Yes,
Yeah.
and so when we describe the Hope Center, we can say that there are no barriers to access, because not only do we not charge fees, but we are available inside the school building during the day. So when, instead of a parent having to figure out their after-school schedule or a work schedule to find time to drive their child to a therapy appointment, our Hope Center clinician is inside the school, and we take referrals from counselors, and we are able to provide counseling during the school day in the building. And one of the things that we hear a lot from our school-based clinicians is how it is decreasing the stigma about getting help for mental health. And Teresa, do you want to talk about that?
Yeah, I think just to add to that, one of my favorite stories to tell is the clinicians that I hear saying, yeah, I'm walking in the hall with the teachers, or I filled in for a little bit of the lunch duty because of certainly with COVID, people are stretched thin in terms of their duties, and a child across the cafeteria says, hey, there's my therapist, hey, and turns to his friend next to him and says, you should really go talk to him, he's super cool. So I think in terms of that destigmatization, that normalization of we're just normal people. Mental health does not have to be this scary, like, I don't know, are they going to make me lie on the couch? I'm not sure what this looks like. But just very approachable human beings connecting with kids on their level.
And that's a beautiful way of putting it.
So at those 13 schools, there's somebody on site at each one of those?
Yes, 2 of the
That's
schools are
fabulous.
elementary schools, and since they're smaller population, the clinician splits her time between the 2 elementary schools, but the other 11 have therapists there all day. When school is open, we are there.
You were there.
And then when school was remote, we were able to connect with students virtually.
Okay, great. Well, you certainly cover all the bases, and we thank you for everything you do. So thank you, Teresa, Carrie, Andy, for another episode of The Story Behind the Story. And we encourage everybody to spread the word about the services that are available through the Hope Center. Thank you, ladies.
Thank you.
Thank you so much.